Wednesday morning, which means we are talking about all things trending in the health world with Dr. Syed Hussain, Trinity Health of New England. Doctor, thanks for being here.
Thank you.
I always like to jump right in so we can cover as much ground as possible. So let's get going here. I want to talk about a new study from the U.S. Geological Society that is saying half of all faucets in the United States are showing some signs of PFAS, chemicals potentially problematic when ingested. Erica's talking about drinking water. Parents are telling their kids to drink water all day long. Talk about the problem. What are we looking for? What are the challenges here?
Sure, yeah, very concerning indeed. Keith, what this study looked at was testing water samples in hundreds of places across the country, and they found over 50% may be contaminated with polyfluorinated alkyl substances. These are chemicals that should really not be there. There are over 12,000 such chemicals, and the study looked at 32 of them, so the number actually may be higher. And these chemicals, or association with these chemicals long-term, may be putting folks at risk of a number of medical conditions. There may be an association with these medical conditions such as obesity, cancer, thyroid disease, infertility, etc. So what you need to do, a couple points that you need to keep in mind is look up your local utilities website, pull up the most recent water report to look at what they're doing. What is your utility company doing to prevent contamination, to prevent chemicals in water that you drink? Use a carbon filter. You'll need to change those filters on a regular basis so that they're effective. A reverse osmosis filtering system is another option, although it's a little pricey. But these are all things people need to keep in mind.
Knowledge is power. Do a little homework on your end, and you should be okay. Moving on this morning, the CDC warning about cyclospora. So that's an outbreak that we're seeing in produce. For folks who don't know what that is, it's a parasite transmitted through human waste. Right now, learning of between 1 and 5 cases in Connecticut. What are the dangers here? What should we know?
Yeah, mostly seen in produce. So when you're dealing with fruits and vegetables, Keith, and symptoms that folks need to keep in mind include GI symptoms. So watery diarrhea, which may be explosive. There's gas, there's nausea, vomiting, stomach cramps, fever. So if you have any of those symptoms, reach out to your healthcare provider. You may be asked to give or submit a stool specimen for testing, and there are antibiotics that are effective against this parasite.
I've spotted you at my farmer's market before. Wash your produce well as well.
Right.
Good advice this time of year. A third topic we want to talk about, this one was the one that probably caught me by most surprise, and it's the rising number of kidney stones being discovered in young people. I know that we don't specifically know why that is the case at this point, but generally speaking, what are your concerns with young people and with kidney stones? Yeah,
there was a study done in 2016 that looked at a pretty large increase in the adolescent age group, children in particular. There's speculation as to the why behind this, but it may be linked to diets that we see high in ultra-processed foods. This age group tends to drink less water. Hotter summers that we're experiencing now may be contributing to it. More use of antibiotics that can change the gut microbiology, all contributing to kidney stone formation. Symptoms that folks need to keep in mind for your children include pain in the abdomen, pain in the groin, darker urine, blood in urine. It's a very painful condition. And you should take your child to the ER if they develop such symptoms, or seek help with a healthcare provider.
Always incredibly valuable information when we stop by. We appreciate your time as always on a Wednesday morning. If you have questions for the doctor, you can send them our way on social media. We'll do our best to pass them his way. Have a great day, my friend.
Thank you. You too, Keith.